Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our host for Redefining Medicine is Dr. Erica Schwartz. For more than 20 years, Dr. Erica has been at the forefront of advanced patient care, taking the best from conventional and integrative medicine and applying them to prevent disease. Dr. Erica is a distinguished A4M faculty member in disciplines ranging from hormone therapy, peptide therapy, and IV nutritional support.
Hi, and welcome to Redefining Medicine. I am Dr. Erica Schwartz, your host. On this podcast, we interview the leaders, innovators, and changers of healthcare. And today, I'm really excited about having Dr. Charles Brenner with me. Dr. Brenner is the one who found nicotinamide riboside as a vitamin that we're all taking these days. So he's going to tell us about NAD and how we can protect ourselves from the ravages of aging. Dr. Brenner.
Thanks, Dr. Schwartz. NAD, it's the central catalyst of metabolism. You know, metabolism is the life force. It's not only allows us to convert everything that we eat into biological energy, but really it's everything that we eat into everything that we are, right? We make all of our own cells, muscle, connective tissue. Unless you have a artificial hip or something like that, you made everything in your body with your own metabolism. And you repair everything in your body with your own metabolism. And so what we found over the last 10, 15 years is that the NAD system actually comes under attack and by multiple conditions of metabolic stress, like overeating is one thing that does it, alcohol, that's been understood for a long time, but then a number of other things like sufficient noise to produce hearing loss attacks NAD in the cochlea, right? Sun damage and reactive oxygen attack the NAD system. You can't go without, sun and oxygen, right? And then infection and inflammation attack the NAD system. Turns out, at least in a rodent system, when a new mother rat or mouse has had babies and is lactating, so a postpartum rodent, its liver NAD system is under attack and it's challenged.
From the stress.
So essentially what we're finding is there's many disease processes of metabolic stress in which NAD comes under attack, and those essentially define the use cases for NR supplementation.
So our NAD precursors, who are they, what are they, and are they new?
Yeah, that's a great question. So NAD precursors kind of were initially discovered back in 1938. So the classic vitamin B3, niacin, and nicotinamide, they came out of somebody named Conrad Elvehem's laboratory in 1938.
Where was that?
That was actually at University of Wisconsin. It's kind of ugly the way they discovered it because they were interested in pellagra, which we don't see anymore.
Right.
And they wanted to develop a nutritional disease in dogs, basically, that was like pellagra. And what they came up with was something called black tongue in dogs. Oh. It's actually bad because probably people's dogs were kidnapped for this research.
Wonderful.
And they discovered that there are these molecules, and they didn't even know that they were NAD precursors. But that's where nicotinamide and nicotinic acid, niacin, came from 1938. Then we later discovered that they were basically allowing, whether it's a person with pellagra or a dog with a pellagra-like disease, to rebuild their NAD, right? You don't see pellagra anymore because generally, unless it's an alcoholic and a really bad diet, we're supplementing niacin into grains, right? So even if someone
in all packaged foods,
even if someone is only
right.
eating packaged foods,
exactly.
They don't have a presentation with frank pellagra, right? But does that mean that their level of vitamin B3 is optimum?
No.
As you know, right. So and then when you get a sunburn or when you're on conditions of inflammation, when coronavirus and flu and RSV are going around as they are now here in, December of 2022 when we're having this conversation, NAD systems are coming under attack, right? So we discovered NR back around 2004. And there's 3 different gene-encoded pathways to take the vitamins and rebuild an NAD coenzyme. So niacin uses one set of genes, nicotinamide uses another set of genes, and then we discovered the nicotinamide riboside kinase genes. Consumers don't need to worry about which of these genes, right? But the thing is, the body kind of knows what it wants. And when NAD comes under attack, the NR pathway gets turned on. So we see, for example, in heart failure, not only in mice, but in human heart failure, NAD comes under attack, the NR kinase genes get upregulated. So if you're supplementing with NR, you're protected, right? Same thing with, with these infections that are going around, inflammatory conditions. If you're supplementing with NR, then your body is likely to be more resilient to these kinds of challenges.
Now, NR, the same as a lot of other supplements, are available in overabundance.
Yeah.
You don't have to go too far to get them. How do you know which ones are the ones to recommend
to
your patients?
Well,
I'm a clinician.
Yeah, of course. Well, I mean, NR was actually, we discovered at Dartmouth. It was licensed by a company called Chromadex, and then we insisted on safety testing, right? Mm-hmm. So there's a product called Niagen that has the big safety dossier. Mm-hmm. I can't really support a couple of other sort of pirate compounds. I don't really know to what degree they've been safety tested. There's NMN as well, right? Mm-hmm. Were you going to ask me about that? So NMN is basically NR with a phosphate group on it. Doesn't really make a lot of biological sense because NMN can't get into cells because it has a phosphate.
So does it ever get into cells?
Well, yeah, it'll get into cells, but basically has to be converted to NR.
Right.
So a chemist,
phosphate has to be removed.
Yeah. So like a chemist is sort of putting the phosphate on, charging you for that
and your
effort.
body takes it off.
Your body's taking it off, and NR is the biggest piece of NAD that can get into cells. So there's even people that are like injecting NAD, right?
Right,
Did
we
you
were
hear
talking about that before. And
Yeah.
Right, we were talking about that, and I was going to ask you about NAD IV. I mean, the people who come to our practice and we do IVs and we don't give them
You're
NAD.
scratching your head and saying, well, where's the safety for this, right?
Right.
And there
also,
is no...
where is it staying?
Yeah,
How is
yeah.
it actually getting to your cells, and what is it going to do?
It basically has to break down to NR, and then
Right.
it's going to get into... But since you can take NR and as an orally available, capsule, right, that has been safety tested, take NR, right?
Right.
So, I was just made aware that I guess it's like Kardashians or something went out and they were taking IV injections and like, let's get to their people and tell them that they don't have to get a needle in their arm to, protect their NAD. It's available as a safety tested oral vitamin.
Right. So that's really important. But now, how is that affecting the myths of longevity that we're talking about?
Right. So longevity, we're all going to age, right? The question is,
I'm not.
You're not going to age at all. So the thing
Refuse
is, part of it actually is how you feel, right? Is how you feel, what you do, right? And so I think it is true that you're as young as you feel.
Exactly. I agree.
On the other hand, if you look at people's like mile times, the world record holders are in their 20s, right? The chess masters are probably in their 30s.
40s.
Right. And women's reproductive aging is obviously a thing, right?
That's a thing.
It's a thing. It's not not the end of life, but it's a thing. That's
because they can stay up at night longer when they're in their 30s and early 40s. And as you get older, you can't stay up that much.
Yeah,
you should sleep at night.
But you know that, like follicular atresia and ovarian reserve,
Yes.
declines for women. So we are all aging. The question is,
Right.
are you going to age poorly and have a lot of morbidity, or are you going to age well and have a lot of vitality?
The goal.
So, right. So, we're going to age, but the use cases for NRs is boosting resiliency and maintaining vitality, and in conjunction with sleep and diet and activity, and doing all the things that keep you happy and healthy. That's the use case. We're not going to tell people that they're going to live forever.
Well, you can listen to some of the innovators, and they're talking that there's no reason for us not to live to 120.
Well, yeah, I mean, we know that there are human beings that can live to 120. And I think that we're going to get more people into their 90s and 100 with better health. I think that that's absolutely a reasonable goal.
Right,
Yeah.
right. And NR is part of it.
I think NR is part of it, yeah.
Well, I think NAD has become what it really should be, which is the centerpiece of energy production at the
Right.
cellular level.
Right.
And I think we all need to understand that, but not the way we take it really needs to be taken with a grain of salt. I think that the IV stuff, I mean, there's a lot of cavalier way of doing it, and then there's the scientific way of doing
Yeah,
it.
thank you.
And you're
Appreciate
the
that.
scientific way of doing it.
Thanks. Appreciate that.
Thank
Okay,
you so
good.
much.
All right.
It was a pleasure meeting
All right.
you.
It's a pleasure meeting you.